the cycle basically involves the surrogate being on medication to synchronize her cycle with either the intended parent, if the intended parent is planning on donating her eggs to be used to create the embryos, or in certain cases also an egg donor might be used to provide her eggs for the cycle. So the surrogate would be placed on birth control pills initially to synchronize her cycle with whomever is donating the eggs. She is then placed on a medication called Lupron, which is used to suppress her natural cycle. And then we start her on estrogen to mimic the first half of a normal menstrual cycle. And then once the egg donor or intended parent is being scheduled for retrieval, then we put her on progesterone, which is a medication or hormone that's required for the second half of a normal woman's menstrual cycle. And that hormone would be used to help support the pregnancy. At that point, when the either egg donor or intended parent is ready for retrieval, we retrieve the eggs, we fertilize the sperm, and then the embryo is transferred either 3 or 5 days later back to the surrogate. And the transfer itself is a fairly simple procedure. It doesn't require any anesthesia. It typically is done within a minute or two, and it doesn't require that the surrogate stays in a hospital or stays in the clinic for a prolonged period of time. She can go home after the procedure. The pregnancy test for the surrogate is typically done about 2 weeks after the retrieval. And at that point, if she is pregnant, then she continues on the estrogen and progesterone support until we can see evidence that the placenta is starting to make hormones to support the pregnancy. If she's not pregnant, then she stops the medication, and that's the end of the cycle.